Hello, this is Dawn Harris, and I'm founder and president of Revelation Gardens, and we are a local Benton County, Tennessee nonprofit animal dog and cat rescue that primarily focuses on hard to adopt rescues. And today this is our weekly Paws podcast, and today we have a guest speaker, Dr. Brittany Hassell, and she's going to be sharing with us about heartworm disease in dogs. So thank you so much for joining us.
Yes,
I'm excited
for
to have you
having me.
here.
Thank you.
Why don't you start off by just sharing a little bit about what inspired you to become a vet and maybe a little bit about your background that might lead into our discussion about heartworm.
Yeah. So ever since I was little, I've always wanted to be a veterinarian. And my dad was in the Navy growing up, so we moved around a lot. But once we settled here in about '04, I remember coming with my mom to the local vet and bringing my animals, and it was with Dr. Elizabeth. And that's when I first met her, and it was just such a welcoming environment that I knew I already wanted to work here.
Nice.
And I was about 10 then. My mom asked if I could volunteer, and Dr. Elizabeth said maybe when she's a little older, when she's driving. So I've been here since 2015 volunteering. I did my undergraduate at UT Martin, and then I got my bachelor in animal science in 2016, and then I went back, got another bachelor of science in veterinary health technology in 2017.
Mm-hmm.
And then I went to the University of Tennessee College of Veterinary Medicine from 17 until 21, and I've been here since 2021 as a doctor. So
That's wonderful.
yeah, and so I've always known I wanted to work with Dr. Elizabeth, and so I'm very passionate about working with the local cats and dogs and occasional pocket pets of Camden.
Yes, we'll have to have another discussion about pocket pets. I'm
Yeah.
curious about that, but we'll stay on topic for now.
Okay.
So thanks for sharing that. So I guess my first question would be, what exactly is heartworms? And, I guess, how does it affect dogs? I know that we had one that was, I guess you consider a hot or a heavy, I can't remember the terminology, and then one that was light. So maybe you could explain that a little bit too.
Yeah. So heartworm disease is a very real, very pressing issue in the United States, but for the most part, it's very prevalent around the southeast because we live right near the Tennessee River. They get them from having from a mosquito. A mosquito will bite an infected animal, and then they will carry that disease over. And then when they bite down on a dog or a cat, they will transfer a small amount of baby heartworms or microfilaria sub-Q and under the skin. They will travel where they're supposed to into the heart and in the lung space, and then that is whenever they become adults, we're able to test for them through our antigen testing. And they have to be so old before that test shows positive. So typically, we start testing dogs when they hit a year of age with their yearly vaccinations. And then after that, it just kind of goes from there. Usually we try to test them again 6 months after starting a new product to make sure that they're still negative. The difference between like a light and a heavy or a hot, they say it both ways, is how deep that antigen will show positive on a test. So they test them through the female heartworms. And so that's what makes the antigen test turn positive. So if they have a large amount of female heartworms, then it'll show as a hot positive. They could have a large amount of male heartworms and only one or two females and be considered a light positive. So that's where it can kind of be a little iffy on, light or heavy.
So why would they choose to test for the females? What's that about?
That's just how the IDEXX was able to make their test work. It's not anything. I think it just made it easier to pick one female or a male antigen, and it made it more specific that way. But we also always do a direct blood smear where we take a small drop of the blood, put it on the slide, and look at it under the microscope to see if there are microfilaria or baby heartworms in the blood too. And if there are quite a few in the blood, then we also consider that to be a hot positive because they're continuously making new heartworms. There's at least one boy and one girl heartworm making more baby heartworms.
And so you said that you only test for adult. Is that again just because of the test to keep it focused in on one specific?
The life cycle of the heartworm, since it takes about 6 months for them to mature from microfilaria to adults. So we just wait for the 6 months.
Oh, interesting. You mentioned cats, so cats can also get it? I didn't know that.
Yeah, so cats are not the natural host for heartworms. So we don't have a good test for cats. If anybody was ever interested or concerned about a cat having heartworms, we could always send off a blood test to an IDEXX or an outside lab. But they don't have a treatment for cats if they were positive, and so there's really not a good treatment protocol, so prevention really is key for cats and dogs.
And this is a little off topic because we were going to just discuss dogs, but how would a cat present if they were positive? Is there
So
symptoms?
similar to dogs, so I can kind of go through the clinical sides for both. So dogs, usually what we see is like a mild, persistent cough, reluctance to eat or exercise, fatigue, decreased appetite, weight loss, and then when it gets closer to end stage, dogs can go into heart failure where they get that big pot belly appearance. They get very lethargic where they can't get up. Anytime they try to do any physical activity, it'll make them cough. Cats are a little bit harder because they cannot have a very high worm burden where dogs can have hundreds of heartworms and seem decent for a long time. Cats really can't tolerate the worm burden that well. So they'll have asthma-like symptoms where they'll be wheezing, coughing. The worst, but usually most common clinical sign is that they just drop dead. And we obviously can't do anything. Once they collapse, it's usually end stage for a cat too. And then again, there's no treatment for them, so there's not a whole lot that we can do for them, unfortunately.
And is it prevalent at any age? So a puppy or a kitten could get it, and all the way up to senior.
They say as soon as they come out of the womb, they are susceptible since it's through mosquitoes that they get them. But usually we see it more in like middle-aged dogs that have been outside their whole life that usually live by the water are the most common dogs that we see with it.
Interesting. So how common is heartworm, and what are some of the myths or misunderstandings that pet owners may have?
So for around here, they are very common. I try to really hammer it home with a lot of clients, especially ones that move from out of state where mosquitoes aren't that bad, or they don't have to keep their dogs on prevention year round because it's so cold.
Right.
That here it's really important that they stay on prevention year round. So some of the myths that I kind of made notes on was that cats don't get heartworms, and they do, they just aren't the natural host for them. So prevention again is really key for cats. Another misconception is that pets don't need to stay on prevention year round. In the southeast, yes, 100%, because we just don't have winters that get cold enough to kill off the mosquitoes completely. Pets that are fully inside that don't need prevention, I've been bitten inside my own house for mosquitoes following me inside. Even dogs or cats that just go out for like an hour or so and go to the bathroom and come in, it's never zero. The odds are never zero. So better safe than sorry to go ahead and just keep them on prevention. Even if my cats are strictly inside, and I still put them on their prevention just in case.
So we have a lot of cats in our rescue, and I've been very diligent about prevention with our dogs. But I guess I fall under that myth and misunderstandings. I guess I wasn't aware that there was prevention for a cat for heartworm. So what is that? And is it a pill? Is it a topical? Is it both? It's both.
Thankfully, cats now have topicals that will do heartworm, flea, tick, and dewormer.
Is that the Revolution Plus?
That has.
So I've been doing that. I didn't know it.
Yep, that has heartworm prevention built into it. Or the Next Guard combo is a good one too. That's a topical that will protect them for a month against it. They also have a Bravecto topical for cats that lasts for 2 months. That also does, I'm pretty sure that also does that. So there are a lot of products, thankfully, for cats. And then some of the other ones, another misconception for some that once they have been treated for heartworms, have gone through the process, that they are unlikely or won't get heartworms in the future, which is not true. We want them to stay on prevention throughout the whole treatment process, and then going forward, they have to be on some sort of prevention. Miss Sylvia, our receptionist, her dog has actually gone through heartworm treatment twice because of just where she lives. The heartworm population is so bad out there. Even though he's been on prevention, they have these breakthroughs of it. So it's hard when you live so close to the water.
That's sad. That's hard on him, too.
Yeah.
I remember Baxter, he was considered light. I guess he had like one worm or something.
Nice, small worm burden, good.
But I remember it was still hard on him. He still didn't feel good. Oh, actually, no, it wasn't him. We didn't end up treating him. And through the prevention, it ended up dying.
Yeah. Eventually, they will die off.
Yeah. We had another dog that was in rescue and we did fostering at that time. We don't do fostering now because of insurance.
Okay.
But at that time, he was in foster and he underwent treatment, and it was very, very hard on. It was actually her, getting my facts mixed up. But yeah, it was really hard on her, and very sick to her stomach and that sort of thing. So I can imagine having to go through it twice. That must be really hard. Yeah.
Do you want me to kind of go over the protocol of that?
Yeah.
So for treatment, we have a couple options. We have the slow kill, which is what Baxter went through, which is Advantage Multi is a topical that we offer through our online pharmacy, and that has actually been labeled to slowly kill off the adult heartworms, whereas a lot of our other preventions are just doing a reach back method is what it's called. So anything that they collect from the month before, when you give them that pill or that topical, it's killing off all of the microfilaria that they got that month. The treatment is killing off the adults. Once they hit an adult stage, that prevention isn't covering them anymore. And so the Advantage Multi is able to slowly kill off the adults over time. If no treatment of either kind is given, it takes between 5 to 7 years for a heartworm to die off naturally.
Oh my goodness.
Long time.
I had no idea.
And so the fast kill method is where we give them an injection of melarsamine dihydrochloride, which is a chemical that kills off the adults, and they have to get injections in their back. Usually 3 injections spaced out over the span of 2 months, and then they have to be on intense exercise restriction. They can't be moving around too much because there's the chance that a large clump of heartworms could move and could cause an embolism, and they could pass from a clot. So that's the scary part. We just need them nice and calm. And usually we check them after 9 months of their last injection to make sure that it was a success. And I want to say 99% of the time it is a success. There's very few cases that we've had to do another round of treatment because of it.
Isn't there some prep that has to be done? If I remember correctly.
Antibiotics ahead of.
Yeah, that's what it was.
We usually give doxycycline for about a month before the first injection to try to help weaken. There's a bacteria associated with heartworms that the doxycycline will kill off so that it makes them into a weakened state to get them ready for it. The American Heartworm Association has a great website that has their protocol, and we try to follow it as close as possible. But we noticed that a lot of dogs on their doxycycline dose got sick to their stomach from it, so we kind of cut back a little bit to make it a little bit easier on their tummies throughout the process. But yeah, usually they are lethargic, and they're a little painful around the injection site after their treatments, and so we try to give them some prednisone to help with the pain and the swelling around the injection sites.
Okay. I'll find that website and I'll add it on so you guys can check that out if you'd like. Well, so it's quite a process. One, obviously, prevention is super important, and on occasion there can be what you call breakthrough.
Breakthrough. Yep.
And then if there is treatment involved, it is a process as well. There's a preparation, and then there's the actual treatment, and then follow-up.
Lots of follow-ups.
Well, that's really interesting. And so I guess the bottom line is make sure that your pets are on prevention. I use for Rocky, our larger dog, the Pro Heart. I think it's every 6 months. There's also a yearly one, right?
Yes.
So we do that every 6 months. And then the smaller dogs, we give the chewable.
Yep.
So, and then cats, I guess I was already doing it,
Yep.
but with the flea and tick treatment. So that's good to know.
Yes, there are a lot of options. My dog is also on the Pro Heart shot. I think it's just easier. I don't have to remember to give something monthly. But whatever you choose, injections, topicals, or chewables, as long as it works for your way of life and the dog takes it, that's all that matters, as long as they're on something.
Yep, that's really good. So I think we talked about everything that kind of, is involved in understanding heartworm, and I keep saying singular heartworm, it's heartworms, right?
Yes, yep.
Heartworms and prevention and all those sorts of things. Is there anything else you'd like to add or you'd like pet owners to know?
This one kind of falls under the category, it's not so much a myth, but maybe a misunderstanding that if you have a heartworm positive dog, are they contagious to other dogs in the household? And that's not the case. The mosquito has to be in that life cycle. But if one of your dogs is positive for heartworms, there's a good chance that the mosquitoes around where you live have it in their system. So just always make sure that all of your pets are on some sort of prevention.
Very good. Well, I sure appreciate your time.
Yes.
And I would love to have you on another podcast at some point.
Absolutely.
Learn more about all the different things that you deal with. And I know it's very useful for pet owners. I want this podcast to be something that pet owners can take away and, apply in their life and help to keep their pets happy and healthy.
That's right.
So
thank you for having me.
Yeah. So thank you for joining us today. I just wanted to take a minute to share that we have a rescue program, and for $20 or more a month, you can help make the lives better for our rescues, and that supports their food and in some cases vetting. It depends on how much is donated. And there's a lot of ways you can be involved in that. You can either set up a monthly donation through PayPal or some of the other mechanisms, Venmo, that sort of thing. Or you could come in person and hang out with the rescue that you're sponsoring. And we do send updates and keep you informed about how they're doing. But we definitely encourage you to come in and spend time with them. So we love to have your support, and we would love to also have you learn more about us by going to our website, which is revelation-gardens.org. And next week, we're going to be talking with Kelly Yearwood, and she's a certified animal behavior trainer, and she's going to be talking about difficult behaviors in dogs and what to do about them. So I look forward to seeing you on our next podcast. And again, thank you so much for your expertise and sharing with us today about heartworms in dogs.
Thank you.
All right. Have a wonderful day, everybody. Bye-bye.